I think volunteering is valuable no matter who you are. It's one of those give and take situations where as a volunteer you're helping someone out, but you inevitably feel really good about yourself as well, that you're contributing to society in general and in a positive way. As a student, it gives you valuable experience that you won't necessarily gain until you're in the workforce. And it's one of those situations where sometimes it can be challenging to secure work because you don't have any experience, but volunteering then gives you that opportunity to gain some of that experience. Someone once told me as well that everyone has to do their apprenticeship. So it's a good way of getting in at the ground level, learning how different things work, and worst case scenario, if you decide that you hate the area that you worked in or the type of work you've been doing, that's a learning experience in itself. Again, I think any type of volunteering is useful, but in particular for public health students, if it was something vaguely to do with health, then it's going to be even more beneficial. And by vaguely anything to do with health is, if we think about the determinants of health, there's so many different avenues. It doesn't need to be in your classical healthcare setting. It might have something to do with healthy food. It might have something to do with footpaths. It might have something to do with housing. So think outside the square when you are thinking about where you volunteer, but be able to relate it back to what you've been learning in public health, so that that can then translate to your CV in particular when you're applying for jobs. I'd encourage you to think of places that are of interest to you. So if you're really interested in, let's just say, heart disease, then have a look at places like the Heart Foundation or places that focus on heart disease. Another thing that would be useful is to also think about where you live or where you might study and what might be easier to get to. So, if it's a cold, wet day and you have to travel an hour to volunteer, there's a likelihood that you might get a little bit of lazy-itis that day. But if it was somewhere nearby, the likelihood of you staying committed would be useful. There's also opportunities to do one-off volunteer stints, so you might volunteer for a fun run that's one day with the Breast Cancer Network of Australia, a Mother's Day Classic for example. So those one-offs start to translate as experience. It doesn't necessarily have to be a whole day or two dedicated week by week. So I think there's lots of different options, but I would strongly advise you to stay with a topic that interests you or you're familiar with, and somewhere that's close by to where you live or you work or you study, so that it's more accessible. So usually when employers are looking at a resume, they're looking at two key things. One is a qualification you might have, which is relevant to the role, and then the other is any type of work experience that can demonstrate that you have the skills that can then be useful to the role that they're recruiting for. Other things that people might take for granted is a legible resume, and one that makes sense and is easy to read. People often fall into the trap of just handing in the same resume for every job without catering it for the job that they're applying for, or taking the time to write a covering letter and highlighting what skills they have that matches specifically to the role that they're applying for. So all those aspects are quite important. When you think about experience you might have gained through volunteering or even working at McDonald's, these all translate and is something that I personally look for when I'm looking for a potential employee. So I've always said I'd be highly likely to take a student that has had credits and passes throughout their university life but worked at McDonald's over someone that has gotten all HDs but hasn't worked. Because to me, the person that has worked and studied demonstrates that they can multitask, that they've got good time management skills, they've been able to do both. They've had experience in a workplace, so they understand what it's like to work with different people and to follow procedures and just some of the general things that come in a workplace. So never underestimate the value of experience that you do have. Like I said, be it working at a fast food restaurant or babysitting, there's all skills and experience there that can translate themselves into a workplace. So you might not necessarily have been a health promotion officer before, but you have got skills and experience you can bring to that. The same with volunteering at a specific health event, or having manned a reception or answered phone calls. There are skills and experience there that you can draw on to beef up your resume and demonstrate that you have had a commitment to working in whatever the environment is. You are used to working with different people, and you are the type of person that can multitask and be able to balance your reading. Another tip that I would have in terms of volunteering and how that could be useful, in particular to your resume and applying for jobs, is the consistency of your approach. Be it the dedicated 1-2 days a week over a period of years, or even that one-off event that you've done. It all translates and it all starts to add up if you have a longer term commitment to it. So don't panic in your second semester of your last year at university and go, quick, I need to beef up my CV. It's think about from your very beginning of your time at university what you might be able to do that in 3 years' time you can say, I've actually got 3 years' experience working in the food industry. I've actually got 3 years' experience working in this particular sector. It all adds up. I remember speaking to a past student who'd been working as a medical receptionist and was applying for a job and didn't mention anything about that role that she'd had. And I said, you do realise you've had 3 years' experience working in a primary care setting? And it hadn't occurred to her to say that. So think about how you can be a little bit more creative in sharing your experience. You're not embellishing and you're not lying, you're just labelling it in a way that you might not have thought to do so before. That translates a little bit better when you're applying for a professional role.